After the author found herself navigating mental health challenges within her own family, she began researching a well known asylum in Maryland called Crownsville. Crownsville has a complicated and messy history. On the one hand, it was a facility literally built on the exploitation and abuse of patients. It was meant to help. And on the other hand, it had committed individuals who sought to preserve patients' dignity and humanity, people who actually wanted to help, people who worked tirelessly to try to make the facility what it was meant to be. The author outlines the desegregation not only of the patients, but the staff members as well, how the concept of it being a Negro hospital was a hindrance for adequate funding and compassionate care. It talks about the horrific abuses and experimentation inflicted upon patients, including Henrietta Lacks' own daughter. The author discusses the ways in which even in more modern times, treatment was more about control than actual care, how mental health institutions often run closely alongside within the carceral systems within the United States. Some things that are still super detrimental to struggling folks to this day. But again, amidst all the horror, there are some incredible folks working within the broken system, doing their damnness to treat patients the way that they deserve to be treated, with care, with dignity, and with respect as human beings. This book gave me a lot to think about, and it gave me a lot to chew on. A lot of the patients that were brought to Crownsville weren't necessarily suffering from mental health challenges. They were patients and people who society deemed had no other place to be. They didn't want them around, whether they were unhoused folks or folks struggling with temporary hardships and losses of jobs, people just being vagrant, people struggling with addiction, things that they couldn't be sent to prison for, they were sent to Crownsville for. And I think a lot about that. There's been a lot of legislation trying to get past. New York is one example that comes to mind about how if you look mentally ill in public, they can detain you and send you somewhere. We know that there are significant crackdowns on the homeless population and the unhoused population. So instead of prison, perhaps asylums. I also think about how the U.S. industrial prison complex is also one of the largest mental health care providers within the United States. And that is crazy to me, which led me to another connection. The author talks about racial violence from Reconstruction and the Jim Crow South. And she asked the question, as a Black person witnessing all of this and experiencing all this, how could you not go mad? And we see police brutality. We see ICE doing what they're doing. We see and hear these stories of women dying in childbirth and being denied care. We see how children are treated by their resource officers and are policed and dehumanized and adultified. We see all of these things happening to the Black community, to the brown community. We see this. And how could you not go mad? How much of this is a chemical unbalance of the brain? And I'm saying this as someone who also has anxiety and PTSD and takes medication for it. How much of this is an imbalance of the brain, and how much of this is a natural response to these oppressive and brutal systems that are being inflicted upon Black and brown bodies on the daily, not just then, not just now, but throughout the entire history of this country? How could you not go mad? An excellent book, so much to think about. The more that I stop and reflect, the more connections that I'm making, the more dots that I can connect to other areas, whether it be prison, to shelters, to detention facilities, to mental health care facilities. I think about all that, and I think about what actual help and what actual care looks like, and what we could be if we actually shifted our priorities and shifted our funding to align with those priorities. What would society look like? And how much better could it be? So although this book was filled with a lot of horror and despair, it also left me feeling very hopeful. It's possible. It's possible for better. We just have to work and demand it to be better. And I know that we can do it.